Immune checkpoint inhibitors can cause the immune system to attack endocrine or hormone-producing glands in the body. What happens when the adrenal gland is affected? What should the patient watch out for? There are several organs in your body that make up the endocrine system. The endocrine system is responsible for producing hormones that regulate important bodily function. These hormones play a key role in making sure that your body works the way it should. The organs include the hypothalamus, pituitary gland, thyroid, parathyroid, thymus, adrenals, pancreas, ovaries if you're a female, and testes if you're a male. The pituitary is really the master gland of your endocrine system. It uses the information from your brain to tell the other organs what to do. The thyroid gland controls metabolism. The pancreas is responsible for producing insulin to help regulate your blood sugar. Ovaries produce estrogen and progesterone. The testes produce testosterone. And the adrenal glands. You have two adrenal glands, one above each kidney. The adrenals are best known for the fight or flight hormone adrenaline, which is created in times of stress. This helps control blood pressure, heart rate, metabolism, regulation of sodium and potassium in your blood, and it also controls steroids that regulate your metabolism. Patients might develop adrenal complications if they've received high-dose steroids for more than a week, because those steroids will suppress adrenal function. The initial symptoms of adrenal insufficiency are fatigue, sluggishness, loss of appetite, maybe irritability, some palpitations, so your heart might be racing, hot-cold differences, maybe some visual disturbances, a headache. In adrenal insufficiency, patients might also develop some alterations in their blood sugar. So if you're a patient that already is diabetic, you may notice that you have less adequate control of your diabetes. You may develop dehydration, weight loss, disorientation, weakness, tiredness, dizziness, lower blood pressure, muscle aches, nausea, vomiting, or even diarrhea. So really a very wide range of symptoms. These symptoms may progress and be life-threatening if they're left untreated. So it's important to contact your healthcare provider and let them know if you develop any new symptoms that you did not have before you started therapy. In terms of evaluation, most of the endocrine side effects are detected with blood tests. In some cases, an MRI may need to be done of the brain also to provide a full picture. Good news about most of the endocrinopathies is that they're very easily managed with adequate hormone replacement as long as they're diagnosed early. But a consideration is that they may not be reversible in all cases. Patients may require lifetime replacement of the hormone. In other words, you may need to take supplemental hormones for the rest of your lifetime. And it's very important that you do not discontinue the hormone replacement unless you're instructed to do so by your healthcare provider. As I said, the good thing is that in most cases, you can continue on with your immunotherapy as long as you've been responding well to them. You may require lifetime replacement of steroids. Typically, this is administered as a dose of hydrocortisone in the morning and also in the evening. You may require an additional steroid as well in order to maintain hormonal balance in your body and to regulate metabolism. However, there are some circumstances in which you may require a significant increase in dosing, and this might be under times of stress, such as fever, surgery, sick days, trauma, infection. So it will be very important for you to carry additional doses of steroid with you at all times. And you'll be instructed by your healthcare provider in terms of what that dosing is. It's not unusual under stress dosing for patients to have to take double or even triple the amount of steroids in order to maintain hormonal balance. So you'll want to make sure that you have ready access to those steroids in those cases. Another important consideration is that you should have a medication alert card in your wallet that describes your medical diagnosis of adrenal insufficiency and your need to be on steroids, as well as a medical alert bracelet in case you're not in a situation where you're able to readily relay that information to another healthcare provider. This will help assure that you receive the appropriate steroids that you need under these stressful circumstances. Again, in most cases with adrenal insufficiency, if patients maintain a hormonal balance and receive their appropriate steroids, they in many cases can go on to successfully be rechallenged and receive their immune checkpoint inhibitor therapy.